Hi, Dr. Vicki Peterson here. Did you know the most common reason someone seeks out their doctor is because they're fatigued? And then really on the heels of that are some other really common symptoms, including anxiety, depression, sleep problems, pain, just feeling achy, having joint pain. And there's one part of the body that, interestingly, is missed a lot, that has at its root, meaning it's responsible for so many of the symptoms that people complain about and go to their doctors for, yet this root cause, this part of the body, is completely missed. It's called your adrenal glands. I've talked about them before, but every once in a while it strikes me that you really can't talk about them enough, because while awareness has increased, which is great, it's still not anywhere near where it needs to be. So your adrenal glands are walnut-sized glands. They're not very big. They sit on top of your kidneys. The word adrenal, ad is above, renal, kidney. So that's where they sit, right on top of your kidneys. And why is it that they're so ignored? It's because we live in a very disease-oriented society. We're all about, is the symptom you're complaining about to your doctor, is that the hallmark of a certain disease? Is it thyroid disease? Is it heart disease? Is it diabetes, etc., etc.? The adrenal glands themselves disease very rarely. And because of that, because of our orientation toward disease, we tend to miss them. We don't look for them. When they do disease, it's extremely serious. Someone would be home on disability, hardly able to get out of bed. So if you go to your doctor and you're complaining of fatigue issues and sleep issues and mood issues and pain, allergies, etc., they're going to go in every other direction, but they're not going to look at your adrenal glands, because if part of the conversation involved how work was going and children were going and how you're running around, and they would instantly and correctly eliminate adrenal disease from the possibility of what's underlying your problem. So it wouldn't be wrong to eliminate adrenal disease, but it would be very wrong to eliminate adrenal malfunction. The nice thing about restoring adrenal function is that it's natural, meaning they don't require drugs nor surgery to normalize. So that's good news. Again, they're missed because we're always going for the disease and going for the drug. And the adrenal glands don't like drugs. They like a natural system, a natural protocol. So there are lab tests, there are functional lab tests that will identify adrenal fatigue, and that's what we use here at Root Cause Medical. And they're very important for so many different reasons. One of the things they do, in addition to making adrenaline, which helps with energy, and when they're not making adrenaline during the day, they're influencing melatonin, which is the sleep hormone, at night, so you get a nice wake-sleep cycle. I had also mentioned anxiety, depression, mood swings. We can also put PMS in there, and migraines associated with the menstrual cycle for women, and perimenopause, menopausal symptoms. So that's a whole facet of the adrenal glands that have to do with the sex hormones. And when I say sex hormones, it's not just about making babies and fertility, it's also about mood and just mental stability. And when the adrenal glands are fatigued or overstressed, they will always go toward making adrenaline and kind of let fall short the production of the sex hormones, because innately they're all about survival, and you putting one foot in front of the other and having enough energy to get through your day is considered their highest priority, and then making sex hormones is a somewhat lower priority. It's certainly not unimportant, but from that moment of making that decision, when the adrenal glands can't do everything, they're always going to opt toward making adrenaline. So you can notice mood swings and irritability, anxiety, depression, whether it's cyclical or not, brain fog, trouble concentrating, fertility issues as well, certainly. And then what's very interesting is that as a woman enters perimenopause, menopause time, what naturally happens is that the ovaries slow down because a woman is not going to be fertile any longer. But that job of making sex hormones is transitioned from the ovaries to the adrenal glands. And it's like a baton pass, and the ovaries say, okay, we're done. Over to you, adrenal glands, to make sex hormones for the rest of her life. And these are not fertile hormones, but they're hormones that keep bones strong and heart strong and keep muscle so you don't go to fat, and also keep nice mental cognitive clarity. So this is something that as soon as a woman starts going through this, whether the perimenopause, menopause time, or younger years, we tend to go toward psychiatric drugs. Oh, you're fatigued, I'm sorry, you're depressed, you're anxious, here's a medication. You're going through menopause and you have this loss of mental clarity and you're irritable and anxious, here's a drug. You're not sleeping well, here's another drug. And so these drugs have dangerous side effects. They're not getting to the root cause, and unfortunately they tend to exacerbate or make worse the actual root cause. So I started this with, I don't think we could learn too much about the adrenal glands, and after 25 years in practice, I still find them to be extremely ignored, and the population doesn't know to look toward them. And it's very interesting to realize that this kind of laundry list of symptoms can have this single root cause. So identifying if you have adrenal fatigue and getting to the root of why. So it's one thing, hurdle number one is, do I have this? Hurdle number two is why. And as Americans, we're quick to say, okay, what do I take? What's the vitamin for adrenal fatigue? And certainly the adrenal glands like B vitamins and certain herbs, but that's not enough. You have to get to the reason why the adrenal glands are fatigued. And if I had 10 patients in the room here with me with adrenal fatigue or adrenal exhaustion, they'd have their own story to tell, and they'd have their own personalized program of how we got to the root of the issue and resolved it. Now, there are certain commonalities. One is, if you're going to make adrenaline and keep the adrenal glands happy, they need food turning into good fuel, in other words, stable blood sugar. So that gets into what you're eating, what your gut is doing with what you're eating. Is it turning it into good fuel? If there's toxicity or an overabundance of inflammation, which, by the way, the adrenal glands make anti-inflammatories, they do so much for you. So I wanted to share this because if it's not you, I can almost guarantee that somebody you know has adrenal fatigue. And the solution is a natural one, no scary drugs or surgery, but it's all about getting to the reason why, not just taking a supplement to sort of feel better for a little bit, but really resolving it. Because when you resolve it, you've handled so many systems of the body that you're almost, a little bulletproof against disease in the future, which is pretty exciting because it does involve not just the hormones, but also the gut and the immune system. So few systems are looked at, and once again, it's all personalized, it's all for you. So please share this video with anybody you know who needs it. I'm here to help. We are located in Saratoga, California, which is in the heart of Silicon Valley, but we're also a destination clinic. So we see patients all over the country. And again, it's a natural program. So if you don't live local, we can still help. But give me a call for a consultation, and we're here for you, here for your family, here for your friends. Don't put up with not feeling well. It's just not worth it. It's so great to have great energy and sleep deeply at night, not be on any medication. You deserve that. You can get that. So reach out. I'm here to help. The telephone number is 408-733-0400, and the website is rootcausemedical.com. I'll see you soon.